Deep fascia. Deep fascia is also known as fascia lata and it has modification too. Fascia lata is tough fibrous sheet that envelopes whole of the thigh like a sleeve, and superiorly it is covered with the boundaries line between the lower limb and the pelvis. Anteriorly it is attached to the inguinal ligament. Laterally it is attached to the iliac crest. Posteriorly, there is gluteal fascia that connects it with the sacrum, coccyx, and the sacrotuberous ligament. Medially, it is attached to the pubic arc, pubis, and the ischial tuberosity. Inferiorly, on the front and the sides of the knee, and the fascia is continuous on the posterior side as a popliteal fossa, and then continues in the lower side of the leg as the fascia. Now, modification of the deep fascia. There are three modifications of the deep fascia or known as fascia lata. That first is the iliotibial tract, second is saphenous opening, and the third is intermuscular septum. First, let's deal with the iliotibial tract. Iliotibial tract is a thick laterally forming a 5 centimeter wide band that is known as the iliotibial tract, and that is a modification of fascia lata. Superiorly, it has two layers on its lateral side. Firstly, that is superficial lamina and the deep lamina. And the superficial lamina is also attached to the iliac crest, and the deep lamina is attached to the capsule of the hip joint. Inferiorly, it is attached to the smooth area on the anterior surface of the lateral side of the tibia. It is a diagram of the fascia and the iliotibial tract. This particular are the two bands which are present and that provides attachment to the muscles called fascia, tensor fascia lata and gluteus maximum. These both are attached to the upper part of the iliotibial tract where it forms a 5 centimeter long band and that is continuous in the lower part from above iliac crest to the lower part in the front of the tibia, in the smooth surface of the front of the tibia. Importance of iliotibial tract. There is two important muscles which are inserted into the upper part of the superficial and the deep lamina, and that is 3/4 part of the gluteus maximus and the tensor fascia lata. Here, as it is shown, this is gluteus maximus, and this is the tensor fascia lata, which is attached on the upper part of the iliotibial tract. And the second importance is the iliotibial tract, which provides stability to the knee while running, walking, and standing erect. It helps in the extension and the partial flexion of the knee. It supports the knee against the gravity, and that is the main important point of iliotibial tract. Second modification is saphenous opening. Saphenous opening is an oval opening in the fascia lata, and its center lies about 4 centimeter below and 4 centimeter lateral to the pubic tubercle. And this is 2.5 centimeter long and 2 centimeter broad, a long axis which is directed downward and laterally. Its opening has a sharp crescent lateral margin that is also known as facial margin, which lies in front of the femoral sheath, and this particular is overlined by pectineus muscle. This saphenous opening is overlying in the pectineus muscle, and the fascia passes behind the femoral sheath. The saphenous opening is closed by a sebriform fascia, which is the modification of the superficial fascia. This covers the opening of the saphenous opening. Now the third is intermuscular septum. There are three intermuscular septum which are present in the anterior compartment in the thigh, which divides whole of the thigh into three compartment, that is lateral compartment, medial compartment, anterior compartment, posterior compartment and the medial compartment. First, starting with the lateral intermuscular septum. It is the thick and the well modified intermuscular septum among the all one and extends from the iliotibial tract to the lateral lip of the linea aspera. It separates anterior and the posterior compartment of the thigh. Medial intermuscular septum that is attached to the medial lip of linea aspera and that separates anterior and the medial compartment of the thigh. Last one is posterior intermuscular septum that is ill-defined or poorly defined. It separates medial and the posterior compartment of the thigh. It is the cross-section of the thigh where the three intermuscular septums are shown, which divides the thigh into three compartments. Firstly, there is lateral intermuscular septum which divides the posterior and the anterior compartment of the thigh, and there is posterior compartment which is ill-defined, which separates posterior and the medial compartment of the thigh. Whereas there is medial intermuscular septum which separates anterior and the medial compartment of the thigh. And this particular lateral intermuscular septum is derived or is the elongated part of the iliotibial tract. Thanks for this video.